Hello, I'm Bella Taylor McGee, reproductive justice advocate and a member of the National OTC Steering Committee. And welcome to Free the Pill Campaign Day. We are here today to amplify the voices and the stories of people who still find it hard to access birth control pill, even though we know that it's been over 60 years since the pill was first approved in the US. And Free the Pill campaign is an opportunity to educate and engage the public in support of over-the-counter access to the birth control pill in the US. More than 100 national, state, and local reproductive justice and health and justice rights and researchers and healthcare providers share a commitment to provide easier access to safe, effective, and affordable contraceptives, especially for those who find it hard to access birth control. So, in fact, as I said before, we're going to amplify the voices of those who find it hard. And we're also going to have an opportunity to hear from people who support over-the-counter access to birth control. Research shows that requiring a prescription is even harder for certain people. So what we're calling for is over-the-counter access to birth controls that are backed by science, affordable, fully covered by insurance, and available to people of all ages. So first, I'd like to introduce you to Kelly Blanchard, who is the president of IBIS Reproductive Health. And Kelly actually leads the day-to-day operations of Free the Pill campaign. Kelly, thank you for joining us.
Thank you, Belle. It's so terrific to be here with you as we mark the third annual Free the Pill Day. As you just mentioned, 61 years ago today, the FDA approved the first birth control pill. And today we're here to talk about some of the barriers people face accessing their birth control, and to also explain how moving a birth control pill over the counter can help address those barriers and be part of the solution. Birth control, I think, as many of us know, as we strongly believe, is a really important part of the full range of sexual and reproductive health care. It should be available, right as Belle said, it should be available over the counter, fully covered by insurance, priced affordably. Birth control pills are incredibly safe and effective, and we'll hear some more about that coming up later from Dr. Tina Rae Bennett. She'll share more about that. But despite how common it is for people to use birth control, lots of people still face barriers to access. So those barriers can be lots of things. It can be having a healthcare provider, the cost of a visit to a healthcare provider, not having insurance coverage, having to take time off work or off school to go and get your prescription, arranging childcare, arranging transportation. All of those things get in folks' way. And these barriers, we know, disproportionately affect Black folks, Indigenous folks, Asian American Pacific Islanders, Latinx people, young people, immigrants, and particularly undocumented folks, LGBTQ plus folks, and those working to make ends meet. And birth control also has a history that is where the development of birth control took advantage of and oppressed people of color. The systematic racism that really underpinned that history continues today and continues to make it difficult for people of color to access the birth control they need. We really need to learn about, to reckon with that history and to acknowledge it, and to really partner with communities of color to make sure everyone can get the birth control they need.
Kelly, what kind of support is available for over-the-counter access to birth control?
Thanks for asking that, Belle. The support for over-the-counter birth control is really strong, and it's from all sorts of different areas from major medical organizations to regular people. So medical organizations like the American College of Obstetricians and Gynecologists, the American Medical Association, the American Academy of Family Physicians, they all support making birth control pills available over the counter. 70% of women aged 18 to 49 support over-the-counter access. 76% of young people believe birth control pills should be freely available without prescriptions. And so there's a wide range of support. We're also seeing all around us different innovations about accessing birth control, right? Some of you might be familiar with some of the apps that really have been increasing in popularity, like NewRx or the Pill Club. Those apps are a step towards better access, right? They allow you to go into the app on your phone to put in your information and have either a teleconference or an asynchronous consultation with a provider who then can get you a prescription, and then the birth control can get sent to your home. We know today that the pandemic has made so many of the existing barriers to access to birth control even worse. Many people have lost their jobs, which means losing their insurance. Getting to a doctor's office, getting to a healthcare provider can increase your risk of COVID-19. So we want to really reduce the travel and the potential exposures for folks. So strong support from all sorts of folks, and important barriers that still exist. This is the reason why we're here calling for over-the-counter access to birth control, so more people can get the birth control they need.
Thank you, Kelly, and thank you for giving us that information. That's very useful. Thank you very much. So again, Free the Pill aims to amplify the voices of communities and shed light on the stories of communities that can most benefit from improved access to contraception. Now we'll speak to Denise Kadena, Policy Director of Bold Futures, New Mexico, who will speak about her work in New Mexico and how we can address the barriers people currently face trying to access birth control. Hi, Denise, and thank you for being with us.
Hi, Val. Good morning. Good to be with you too.
Okay. So tell us about the work that you're doing and what's going on in New Mexico.
Absolutely. So Bold Futures is a reproductive justice organization based here in New Mexico. We have celebrated our 20th birthday doing this work. And, we are really working so that people can make real decisions about their bodies and lives. And part of that is contraception access. So we have been part of legislation to make sure insurers cover contraception. We have been part of protocols to allow pharmacists to prescribe contraception. And then we've been really proud to be part of the Free the Pill team to bring contraception over the counter, because we know our communities of color, working class people, LGBTQ people, we have had some of the biggest barriers in accessing contraception. And this over-the-counter option allows us to access care we need when we need it.
Why do you think barriers fall harder on certain communities?
Well, that's a whole talk you could give, I could give. But of course, it's about structural racism, is about the impacts that healthcare has had on our communities. I come from a majority rural state where we have healthcare provider shortages in almost every single county in our state. And just resources have not been dedicated to our communities. At the same time, the foundation of contraception was literally tested on the bodies of Black women, Indigenous women, Latinx women, disabled women. So at Bold Futures, we really try to play a fine line of saying, everybody deserves to make this decision for ourselves. And a key part of that is access.
So what can we do to address these barriers? What do people need to do?
Well, we've really taken a multi-tiered approach, like I was saying. A lot of, healthcare accessibility in our country, unfortunately, is about people not being able to afford care. So Bold Futures has really been focused on insurance coverage, Medicaid coverage, so that people don't feel like they can't afford the care that they need. I know everyone on the Free the Pill team has been really focused on, we don't want to take an over-the-counter option and make it available and have it be, $100 a pill pack, because that would just be, serving communities that can afford it, and that's not acceptable. So for me, focusing on cost is a really huge option. Otherwise, like I said, making contraception available to folks when they need it. Like, if a working class person has a 24-hour pharmacy in their area, the fact that they can get off on their night shift, go pick up their contraception, that would be game changing.
Exactly. Now, these sound very much like systemic barriers that we need to address. What exactly is your organization doing to address them?
Oh, that
I know it's a challenge.
the systemic issues go so deep, right? Our healthcare system is broken. It has been since its inception, so we need a rewrite of our entire healthcare system. But, I guess I see our work as doing harm reduction until we get to that place, right? So, like I said, working on the insurance coverage policies, we worked on a protocol to allow pharmacists to prescribe contraception. That one was a big one for me growing up in a rural state because I come from a tiny town where my dad was the mayor, right? So of 2,500 people. So I don't necessarily want to go to the doctor in my tiny town, but it means I could go to a pharmacy, in another city and get the care that I need. Even if somebody doesn't have an OBGYN, a family physician, they might have a pharmacy in their local community. So here in New Mexico, we've really just been trying to break it down piece by piece to say, how can we keep getting closer to getting folks the care that they need?
Okay. Is there anything else you'd like to share with us about your work and about what you think needs to be addressed regarding systemic barriers and ways to make sure that communities who are disproportionately impacted by the barriers have access?
Absolutely. I think a lot of folks don't know the history of the development of contraception. I believe in contraception. I work on these issues. But there were really significant issues in the development of contraception, that the FDA was testing contraception before it was approved with Native American women through Indian Health Service, that women who were put in residential treatment facilities were used as guinea pigs, so I want people to know that history. And I want providers, and Bold Futures trains on this. We train providers all over our state to really recognize that many of us have our own expertise and wisdom, when we might not be choosing a LARC because it's interrupting our period, that might have generations of connections to our families, to our traditions. We're not making those decisions in ignorance. And people in communities of color, queer folks, we need to be trusted in our own expertise and listened to by our providers.
Excellent. Well, thank you so much, Denise, here for joining us, and good luck on the work you're doing with Bold Futures. And thank you very much.
Thank you so much.
So as Denise mentioned, there are many barriers that are in the way of communities accessing safe and effective birth control. So now we're going to hear from someone who's also on the front lines of those issues, and that's Dr. Tina Rae Bennett. She's a physician and research scientist at Kaiser Permanente, Northern California, and she will talk to us more about the work that she's doing in the Northern California Bay Area.
Thanks,
Dr.
Belle.
Bennett, thank you for joining us.
It's really nice to be here today on Free the Pill Day. So as we've all noted, birth control is extremely safe, effective, and common. And as we all know, it's popular. It's what I spend a large part of my practice doing, is prescribing birth control for women. So more than 99%, virtually all women who've ever had sex will use some form of birth control. And 60% of women are currently using birth control. And as we've mentioned, the birth control pill is one of the most popular forms of reversible contraception available today. And while we've talked a little bit about the dark history of contraceptive research, I think what people do need to know is that the birth control pill is one of the most studied medicines available. And we know from decades of research that it's not only safe, but it's very effective. In fact, we know that the birth control pill, when it's used perfectly, it's over 99% effective. And even in typical use where maybe you forget a pill, or you stop and start your pills late, they're still over 90% effective. And there are, very few other effective methods that are that good. I think about the thing that I think is not advertised as much. We know they're safe and effective, but there are also a lot of non-contraceptive benefits to using the pill. I mean, birth control pills make periods less painful. They can improve acne, and they've been shown through this research to prevent some forms of cancer. So they're not only useful and helpful and convenient for our lives, but they also have other health benefits. So as healthcare providers, we are always out there trying to help our patients find the methods that are right for them.
Well, Dr. Bennett, when I met you years ago, you were working very closely with young people and access to affordable contraception. Is the birth control pill a safe option for young people?
Absolutely. It is safe, and actually it's even, I think, even more important that young people use birth control pills. But for young people, it's a great option, but the prescription requirement can be a barrier. Think about it. You're a teenager. You might not yet be talking with your parents about birth control, and you have to access the healthcare system, a doctor. You're in school when most doctors' offices are open. You may be in college, and you're at home half the time, and you're away someplace. So you've got to carry prescriptions with you from place to place. And then we all know we have, working mothers, working individuals who, the requirement to access the healthcare system can be a barrier to getting birth control. This is the reason that many healthcare experts, like members of the American Medical Association, the Society for Adolescent Health and Medicine, and the American Academy of Pediatrics endorse and support the availability of over-the-counter birth control. In fact, we are very, very cognizant that people of all ages can make the right decisions. They know what's best for them, and they can do that without visiting a doctor's office. So this is why we're here today on Free the Pill Day, because we think it's important. It's a great method, a great, safe, effective method, and we think women should have, especially young women, should have access to this method without a prescription.
Well, Dr. Bennett, we know that this science bears out what you've said today, that birth control is a safe, effective option for young people. But what do you say to a parent who is concerned that if their child has access to the birth control pill, they may become more sexually active or become sexually active at all? I mean, what do you say to someone who has that kind of concern and consternation?
Well, I say, adolescents are going to be adolescents, and the birth control methods themselves don't drive behavior. And what we want most for teenagers is we want them to be safe. And so by not having birth control readily available, it's not necessarily going to change their behaviors. And so what we can do is actually make it harder for them to be safe. And so that's what I tell my patients. I go, what do you want for your adolescents? You want them to be safe and be protected, and they are growing up, and it's natural to be with their peers, and so we want to make it as easy as possible for them to do things that are going to be safe and protect their health.
Thank you very much, and that's really, really good information. So, Dr. Bennett, thank you so much for joining us, and thanks for sharing with us all the work that you're doing and the information that you've passed on. Thank you so much. So speaking of young people, we have some special planned for our event today. Now I'd like to introduce you to Michaela Gaviola, student at Indiana University and steering committee member on the Oral Contraceptives Over-the-Counter Working Group. Hi, Michaela.
Hi, Belle.
Thank you for joining us.
Thank you. So today I am riding on a high because I just finished my last final of college and now I get to celebrate Free the Pill Day with you all. So as a student of public health and as someone who does research in contraception access for young people, I'm really excited to raise awareness about an issue close to my heart. Belle, we're about to visit the Free the Pill virtual store, where you'll enter into a wonderful world where birth control is not only available over the counter, but it is also covered by insurance with no age restrictions. Inside the store, you'll learn about the barriers to birth control access, view Free the Pill art, and my favorite part, take action. The virtual store shows us what's possible if we free the pill.
It's exciting.
Hi, Belle. Hi, Michaela. Happy Free the Pill Day.
Happy Free the Pill Day, Lincoln.
Hi, Lincoln.
Hi, we're so excited to be here with you, and we've been working on this virtual store for the past year and a half, I think. It initially started as an in-person 2-week pop-up that was supposed to premiere in Chicago in April 2020, and Belle and Michaela, you know the rest. That did not happen. So we have an online store to really show people what we're working towards, right? A store like Walgreens or CVS where you can get your birth control over the counter without age restrictions and covered by insurance. So shall we take a look?
I think we should.
Let's do it. Let's do it. Perfect. So here we are. You are all actually getting a very sneak peek of it. It launches on Monday, but this is our Free the Pill virtual store. It's a store that has been worked on by so many young people in our Free the Pill Youth Council at Advocates for Youth with our partners at IBIS and so many different creatives. So I'm going to take a bit to walk you through it, but we definitely want to see you inside the store. So please check the chat for the link for our Monday virtual ribbon cutting ceremony where we'll walk you through and you can hear from some of our council members. So here we are at the store. We see the instruction page. I'm gonna get going. So first up, I do have to focus on our wonderful cat. If you have a name for this cat, please tweet, Instagram, message us with the hashtag #FreeThePill, and maybe you'll name our cat. So the Free the Pill virtual store, as you can see, birth control. It's really helping people understand what we're talking about when we say over the counter, without age restriction, and in your local CVS or Walgreens, your local pharmacy. So visitors to the store can come in, they can start learning about the barriers that are in the way of young people, especially low income, trans, queer, and other marginalized youth when it comes to obtaining a prescription for birth control. So this is our little store phone that we have, and it's with you throughout the store to give you the information, the sources, and a lot of feedback from our young people along the way. So now I'm just going to walk through, and we have this beautiful mural from the wonderful artist Mona Chalabi. Mona is an incredible data visualist. I'm getting my sea legs, if you can see. Is an incredible data visualist who was able to really visualize, why it's long past time that the pill is over the counter. This mural, which was premiered last year on our Instagram account, Advocates for Youth, really shows how Tylenol and cough medicine and the birth control pill meets the requirements that the FDA sets to be over the counter, yet we know it's not over the counter, it's not accessible. And this mural by Mona Chalabi really shows the research behind the pill and the studies that show that pill users, including young people, are able to use simple checklists to accurately identify health conditions that might make using contraceptive pills unsafe for them specifically. So this visual, again, you can click your phone, you can hear about all the medical organizations that have recommended a pill over the counter as you're shopping in the store. I'm gonna go over here, and your phone's with you all the time for that handy info. Over here, we have our wonderful greetings from the aisle. wish you were here. We wish birth control was over the aisle, over the counter in your local CVS and Walgreens today. But while we work towards there, we wanted to show you what this store actually looks like in the very near future. One of my favorite parts about this is just how involved our youth council was. The Free the Pill Youth Council is the council that we launched around 2 years ago in partnership with IBIS. And they're a wonderful group of youth activists working across the country to make sure a pill comes over the counter without age restrictions and is accessible for young people. So you can see on the community message board, just like your local 7-Eleven, your local Walgreens, your local corner store, showing really why these young people are invested in freeing the pill. I do have to give a plug for the young people watching, for adult allies who have youth activists in their communities, that Advocates for Youth is currently recruiting for youth activist programs, and applications close May 16th. So if you want to have an opportunity to be a part of the Free the Pill Youth Council, or Abortion Out Loud, or the Muslim Youth Leadership Council, one of 10 of our programs, you can check the chat to go and apply, or send the application to a youth activist in your life. The last thing I want to show you in this sneak peek is, what is this store for? The store, first and foremost, is to help people visualize the barriers that are in the way of young people, but it also is focused on making sure we're mobilizing people to act. So if you go to the Free the Pill checkout, you'll scroll up, we have an alert on our phone. The alert on our phone asks us to help free the pill by adding your name to a petition that young people have created to tell President Biden that we've heard his campaign promises and his remarks around following the science, and why following the science means bringing a pill, again, over the counter, without restrictions, covered by insurance. So we are so excited to premiere the Free the Pill virtual store. It's not going away. It's going to be permanent, and we're so excited to make sure that everyone understands the future that we're working towards. So I think I'll stop there on that really quick preview. But again, we're launching on Monday at 11 a.m. So please check the chat for that virtual ribbon cutting link with some special guests and some prizes. And I will say that if you visit the store, you have a chance to get very, very cute Free the Pill merch, including this Free the Pill pouch, which can be used for your birth control pills or your COVID vaccine card. Thanks so much. Thanks so much for having us, Michaela and Belle. And I really can't wait to see all of you in the Free the Pill virtual store.
Thank you so much, Lincoln, and thank you, Advocates for Youth. This is fabulous, absolutely fabulous. The work is incredible. And can't wait to see the real thing on Monday, right?
Yes,
so
I'll see you there,
Michaela,
Belle.
Thank you again, Lincoln. Michaela, do you want to wrap this up and sort of give us sort of your take on what needs to happen going forward as we talk about access for young people to and access to birth control?
Yeah, well, like Lincoln said, it's time to take action. It's kind of been overdue, and I think young people are at a prime position to continue the work that everyone on this live stream has been working on so far and make this dream into a reality. And I'm really excited for everyone to see what we can do as young people.
You can obviously do a lot. I mean, we've seen that, and thank you so much. What a great way to end today's show, to talk about what you're doing with Advocates for Youth and to hear from all of the experts who've talked about the barriers to access and how we need to address them. Again, I want to thank all of you who tuned in today for our live stream. Thank you again for being here and supporting the work of IBIS and reproductive health, as well as access for young people and access for all of the people who are trying to access birth control. Again, it should be affordable, accessible, and it should be easy to obtain. So I want to say that for everyone, you can tune in and follow the Free the Pill campaign on Instagram, Twitter, and Facebook. And again, thank you for joining us. And again, have a great day. And thanks again for all the work that all of you do and the support of everyone. Have a good day.